Hi everyone, in this class we'll discuss about the anti-anginal drugs. So before we'll discuss about the anti-anginal drugs, we should know what is angina and what are the various types of angina and what is the patho behind it. So then we can easily understand how the drugs works. Okay. So here what do you mean by angina? Angina is nothing but it's a pain or discomfort in the chest. So central chest, which is due to a transient reversible ischemia. Decreased blood supply to the myocardium may causes the ischemia of the myocardium. So thereby which is associated with the pain and discomfort, heaviness in the chest. So this is considered as the angina. Okay, so what are the various types of anginas? So there are three types of anginas. What are those? Stable angina, which is also called as classical angina, and exertional angina. So second one is unstable angina. Third type is vasospastic or Prince metal and variant angina. So what is the patho behind all these three anginas? So here in case of stable angina, uh, there is a stable atherosclerotic plaque. Stable means what? So this is less likely to be rupture. So with it is the atherosclerotic plaque is fixed. Okay, so which occupies almost 70% of the coronary blood vessel. So here in these situations, the blood flow through this narrowed blood vessel is sufficient. Blood flow through this narrowed blood vessel is sufficient enough during the rest. So, but when the cardiac work is increased due to physical exercise, due to other emotional stress, or due to other works, sexual excitement, and all those situations, here uh, the blood flow is not enough through this narrowed blood vessel. Okay, thereby the person may get the pain. Ischemia may cause, and this may causes the pain in the chest. Okay, so this is called the stable angina. So how can we reduce this? Here it is due to what? Increased cardiac work. So then we reduce the cardiac work, ultimately the oxygen demands of the heart is reduced, so ultimately the pain is relieved. Okay, so this can be managed by giving the drugs that reduce the cardiac work. So how what are the determinants of the cardiac work, we'll discuss later. Okay, so in case of unstable angina, so here unstable angina, there is not a there is no fixed atherosclerotic plaque. So what do you mean by not a fixed atherosclerotic plaque? So means it contains the thin fibrous cap, which is less likely to be ruptured. Sorry, more likely to be ruptured. So when it ruptures, it can attract the platelets and then followed by the fibrin deposition. So which can increases the obstruction within the coronary blood vessel. So obstruction may becomes 90% or more. So then what happened? So the blood flow through this blood vessel is insufficient even during the rest. So that's why more severe pain and pain occurs even during the rest as well. Okay, so that is considered as the unstable angina. Prolonged and severe pain may occurs. Okay, in case of what is the third category? Variant angina. So what do you mean by variant angina? Here in case of variant angina, there is a simultaneous or spontaneous coronary spasms. So because of these spasms, the blood flow to the heart is reduced. So these are the three types of anginas. Okay, so here in case of variant angina, how can we relieve? By dilating the coronary blood vessel only we can reduce the condition. So here in case of stable angina, by reducing the cardiac work, we can reduce the uh, anginal pain. So in case of third type, so apart from treating these two, either by dilating the coronary blood vessel, either by improving the blood flow to the heart, or by reducing the cardiac work, so apart from treating the anginal symptoms, we can also manage the chronic conditions. What are those here? So here it is a fibrin deposition, and here it is a atherosclerotic plaque, and here it is a platelet deposition. So that's why we can control all these three. So that's why we can use hypolipidemics additionally, and antiplatelet drugs, as well as fibrinolytics. So these are the strategies for treating the angina. So here in case of stable angina, we discussed one point, right? So what is that? So it can be controlled by reducing the cardiac work. So how can we reduce the cardiac work? Here we can reduce the cardiac work by three strategies. How? So one is by reducing the heart rate. So when the heart rate is reduced, ultimately cardiac work is reduced. So when the force of contraction, when heart has to contract more, which is reduced, so ultimately the cardiac work is reduced. So then what? Another two mechanisms are what? So by reducing the preload and by reducing the afterload. So what do you mean by preload? Preload is nothing but left ventricular filling before its ejection. End diastolic volume is considered as the preload. So when the end diastolic volume is more, so whenever the cardiac return is more, venous return is more, the end diastolic volume is more. So how can we reduce this? By dilating the veins. When we dilate the veins, so the cardiac veins has to work against the here, which causes the peripheral pooling of the blood, more blood towards the to downwards. So that's why amount returned to the heart is reduced. So thereby ultimately the filling of left ventricle is also reduced. Ultimately the pressure is also reduced. Ultimately the cardiac work is reduced. So and then third is by reducing the afterload. So what is afterload? Afterload is nothing but the pressure that has to work by the left ventricle against the to eject its blood. So here when it has to, either it has to work forcefully to eject the blood or less forcefully to eject the blood, it depends on. Okay, so when it forcefully when the left ventricle has to forcefully work to eject the blood, so when the aorta is constricted. Okay, so when the aorta is constricted, so towards this constricted aorta, in order to eject the blood, uh, ventricle has to contract forcefully. So it contracting forcefully means it requires more blood, more oxygen. Okay, so more work, it has to work more, right? So here into dilated blood vessel, it can easily pump the blood, it does not works more. So that's why the afterload is ultimately reduced. So how can we reduce the afterload? By dilating the coronary blood vessel. So these are the approaches for treating the angina, either by reducing the cardiac output, by dilating the veins, or by dilating the arteries, or by reducing the heart rate and force of contraction, or by uh, directly dilating the coronary blood vessels, or by hypolipidemic long in the long run, which is managed by giving hypolipidemics and antiplatelet drugs and etc. Okay, so then we'll discuss what are the various classes of drugs that can used for the angina. Okay, so these are which includes nitrates, beta blockers, calcium channel blockers, potassium channel openers and others. So here in the nitrates there are two classes, short acting and long acting. Short acting includes glyceryl trinitrate or nitroglycerin. So long acting includes isosorbide dinitrate, isosorbide mononitrate, erythritol tetranitrate, pentaerythritol tetranitrate. So beta blockers includes, we already know, propranolol, metoprolol, atenolol and etc. So calcium channel blockers includes verapamil, diltiazem, nifedipine and amlodipine. So then potassium channel blockers openers includes nicorandil. Others are typiridamol, trimetazidine, ranolazine, ivabradine and oxyfedrine. Okay. So then in the following classes we'll discuss each and every class in detail, and how they relieve the angina we'll discuss.